We're going to have a cardiologist speak with us today. Dr. Zadei has been practicing in the Plainview area for over 40 years. He's very well respected, very well known, and he's going to talk to us today about the heart and some of the conditions that people that have high blood pressure, diabetes, are predisposed to. Dr. Zadei.
Thank you.
Hi, ladies and gentlemen. Make it a little informal, so I try to talk to you for 15-20 minutes in very simple words that is understandable for everybody. I think the most common problem that we have is atherosclerosis, or hardening of the arteries of the heart, which is causing like 6 to 7 million admission to the emergency room every year. And out of that, almost 3 million are admitted because of either sudden or gradually, but to the most tight level of narrowing of the arteries. These arteries are called coronary. So when we are talking about coronary, we are talking about the artery that is specifically brings the oxygen and nutrition to the heart muscle, like any other artery. You people do weightlifting to build up the muscle. The heart pumps and keep the muscle in a steady way as it's set genetically. So as long as it gets enough oxygen, enough nutrition, it does its job properly. But along the way, as we get older, the lining of the artery, which is very, very thin, almost made out of one cell, we call it endothelium, but I don't want to go to the technical things. So this lining of artery starts becoming a little thick. That's why we call it hardening of the artery. If you look at the artery versus vein, vein is like a balloon. Let's say that if there is no air in it, it collapses. Artery, even if there is nothing in it, stays open. And the reason is that because there is a middle layer of the muscle. They call it the smooth muscle cell. So the artery starts from one layer of cell inside, the most inner part, and then muscle around that. Keep it round and open. So let's go back again. From the birth to old age, this artery contract and hold the blood, contract and hold the blood. So as a result of shear and tear, they start becoming a little rough in that layer of the artery, which causes the plaque. Plaque is the cause of heart attack in the eventual time. All right. As we get older, naturally, we start getting hardening of artery in a natural way. We get creases on the skin, or chin drops down, and so on. But when we get accelerated way of aging, which is starting at the small, thin layer of the artery, all the problem starts. Now, we want to find out what makes it to go faster. What encourages this damage to happen earlier and progress faster? And the simplest one is the smoking. All right? Because as a result of that, due to the product that it has, it damages the lining of the artery, the endothelium. I go through all these risks and then I tell you what will happen to that wall that causes the plaque. Diabetes plays a big role. Being overweight plays a big role. We know these days that the fat tissue in the wall of the abdomen is not purely fat, but it works like an endocrine, like a gland that secretes certain hormone, that this hormone creates systemic, all over, inflammation. What's the inflammation? If you bang your hand somewhere, what will happen? It swell up, become red, and painful. That's inflammation. So the same inflammation can happen any part of the body as a result of secretion of this hormone. This hormone set up other hormones that we see is elevated in rheumatoid arthritis, lupus, and other autoimmune disease, the disease that body rejects against itself. All right, so when we get this inflammation, the same effect happens in that lining of the artery. So far you follow me. Smoking, blood pressure, obesity, diabetes, if I didn't say, stress plays a big role. Because the stress causes the stress hormone, which by itself, again, apart from changes that it does to our hemodynamic or circulation physiology, it can also increase inflammatory problems.